Today, you're going to take in a lot of information. I want to read the purposes and the objectives of the American Academy of Biological Dentistry. The reason why we're going to do this morning, even though you all have a copy of it, we want the people that will be viewing the tapes to understand this, because this may not go along with the tapes. The purpose of the American Academy of Biological Dentistry is to promote biological dental medicine utilizing non-toxic diagnostic and therapeutic approaches in the field of clinical dentistry. The objectives. We propose to accomplish this purpose by actively importing the technology and knowledge that our German colleagues now possess. Seminars on biological diagnosis and therapy with medical dental therapy, literature, and instruments will be presented. We will also promote the transfer of worldwide biophysical knowledge to the field of clinical dentistry. We intend to bring the theory and the practice of traditional Chinese acupuncture into better focus so as to act as a unifying concept to allow the biologically oriented dentist to participate with the biologically, ecologically, and environmentally oriented physician in the resolution of their common patients' disease states. A network of physicians and dentists working conjointly to provide unified diagnosis and treatment procedures for their common patients will be established. Dentists will play a greater role in the treatment of environmentally ill patients and those whose disease etiology is still identified as idiopathic or unknown. We intend to promote biocompatible corrections and restorative dental procedures based on our knowledge of, based on our scientific knowledge of energy, electromagnetics, sound, light, acupuncture, homeopathy, and nutrition, in addition to the myriad of traditional scientific disciplines that constitute clinical dentistry. The acknowledgments. On this paper here, I have the AAB acknowledges EAB and the great work that Reinhold Boll, MD, initiated and developed with the help of Dr. Fritz Kramer. I left that out because I really didn't know the role that Fritz played. I only had an inclination when I looked in Boll's book at the bottom of the chart, the energetic tooth relationship chart. Kramer's name appears. And I don't think it appears too much more in the books. Of course, I haven't read them all, so I don't think anybody ever reads them. They buy them all, but they don't read them all. Has anyone read them all? Oh, Sam did. Okay. His establishment, or their establishment, of the energetic relationships of the teeth to the organs, glands, joints, muscles, nerves, vertebrae, dermatomes, sinuses, reflexes, and fields of disturbance will usher in and become an integral part of the foundation of 21st century dental medicine. 21st century dental medicine will be concerned with the depollution of the internal and external environments. It is time to correct our mistakes and become biologists of the mouth in addition to our technical expertise. Physicians and dentists must work together for the good of the whole person. The fragmentation caused by specialization must be rethought. An integrated and unified approach of mind, body, and spirit in diagnosis and treatment must be instituted for all. And it's with these thoughts that we invite you all to become members of the American Academy of Biological Dentistry. And also to those of you that are viewing these tapes, we will show the address in sometime today here, because I don't have a piece of paper in front of me, but we'll do that a little bit later. So this morning I would like to introduce to you, maybe I want to get back to the microphone again. This morning I want to introduce to you Dr. Jochen Gleditsch, physician from Munich, Germany, West Germany, and he's the author of the book that you see up here, Mutakupunktur, mouth acupuncture. And I think you're going to find today a very exciting day and learn some things about your field of interest, or close to your field of interest, that you probably don't know. Dr. Gleditsch.
Morning, ladies and gentlemen. Thanks, Dr. Rana, for having me invited here. I like to come here to speak here to you, but the problem is the language. You know, and I have not so many words, and please understand that it will be a little difficult sometimes to understand me, and if I will be allowed to get some help by my wife, I would be very thankful. Dr. Kramer had it very good by this translation done, and I like to have the same, but Dr. Arana asked me I might have a try to talk in English, so excuse my very bad English. And next I have to say that I like to be here together with Dr. Kramer, for he had been my dentist many years, and he had cured me, I have to say to you. For to begin with my own story, as I was a child, I had stones in my pelvis, and I had lots of pain of it, and the physician didn't think of it, what it might be caused. And so if I had sports, everything, I had so much pain that for 5 or 6 years I was not allowed to have any sport. I couldn't go for football or baseball. I was only a sick boy. And it was nice, it's not nice in this age to be so retracted in life and not to have exercises or anything. And later on, when I was about 15 years old, I had been operated and the stones had been taken off the pelvis, but it gave a relapse, and I had another operation when I was about 35 or 36 years old. And at that time it was worse, and nearly the kidney had to be taken off too. It was very much damaged already. And later on it came this big change in my life, which many of you can understand what I mean. I had been a dogmatic or a medicine man, trained in all that we had to be trained at the university, but I didn't know about all this we talk now about. The first, maybe, that I had been confronted with neurotherapy, that we will talk about, and you know a lot about neurotherapy. And more I was engaged with acupuncture and homeopathy, but it is a change not only in our profession. In my opinion, it is a change in our life. For you have really to remove so many things of your thoughts, of your plans, and what you, if it is nutrition, if it is behavior, so many things we have really to change. And it was hard to stand. And at that time, I had problems with my teeth. And I think this is very typical. We will talk about later on that if such a special turn in your life, a special change in your life takes place, it is somatically manifested too. And very often in the oral cavity or in the sinuses, which is now my specialty as ENT doctor. So we very often meet such people in such special crisis of their lives. And at that time I came to Dr. Kramer, and he did the test I could realize yesterday again, which was very exactly done by him, and it was an amalgam. When he put the nosodes of amalgam, my kidney was normal, 50. And so all my problem from my childhood, the many years which were really very hard to stand, it was for myself the amalgam problem. Maybe that is a special case. Another case may be quite another one. But we have to learn that the sensitive man, and I think we all that meet here, and we are interested in acupuncture, interested in measuring such fine method as we have been taught now, that we are sensitive people in a way. Otherwise we wouldn't be here. And therefore we have to learn that each case each history of our patient can be quite another one. But in many, many cases, really, it begins with a problem caused either by a dentist or by an ENT doctor, as I am now. For I have also learned that children, as it was especially in Germany, about no more than 20 years ago, 25, 30 years ago, when they had been operated in the tonsils or the adenoids, they didn't get deep narcosis as we do now in ENT, and narcosis, say the same?
Anesthesia.
Anesthesia by intubation. In this time we had only some drops on the nose, and the kids were sitting, and the operation was very quickly done. But when they were awoken again, full of blood for about 10 minutes or longer time, and pain, and so many, many kids were shocked. And I have learned by a paper from a very good ENT professor here in the States that this shock, especially for women, can be so a deep one that she can't stand if anything would be done in a mouse, but not only in the mouth, but also in the other region, which is very, you know what I mean, that they can get free beat by this too. You know, the mouth and our lower part, they are, it's an analogy, you know. And therefore we have really to learn that by ENT doctors and by dentists, there had been many, many traumatic insults in our patients. It's hard to say it, for I have both professions. I have done dentistry in 10 years, and now I have done ENT in 20 years, but we have done a lot of things I now am very sorry that I have done. I have to confess it. But once again, Dr. Kramer, when I came to him, and he looked at my teeth, he found out that the amalgam had caused all my troubles during my childhood. My stones I had been suffering of in many, many years, and now it was my mistake that I didn't stay with Dr. Kramer as a patient, for it was for me a little long to go to Nuremberg. So after he had done the measurement, I went to a friend of mine in Munich and said, I have these results of my measurements. Please, all amalgam fillings had to be done out. And he did it. He did it in 1 day, in 1 hour, and I was suffering for 3 months. In spite I had homeopathic remedies, but you can't stand it. I think it was about 12 fillings. You see how hard it is to stand it. This boring and this many amalgam you swallow it. And it goes in the pockets of the gingiva and maybe so many insults by it. So I have learned again, if you have a good dentist, stay with him. And all treatment might be done in his hands. It might have been better in my case, I know it now. And so you have learned a little of my own history. That I had become a dentist was a special history again. For when I was a child, and I was about 15 years old, I had not yet become my front teeth. I have not yet got my front teeth. My front teeth. So an X-ray was done when I was about 14 years old. And this X-ray showed that not only there were the permanent teeth, but 2 teeth more here. And there are 2 other more teeth. I have 1 left now in the premolar of the lower jaw. And so I had been operated when I was about 15 years old by a professor of the university, a very nice man, and he gave me a mirror, and I could sit and look at this operation. And when I came home, I said to my parents, this I'd like to do, to operate patients in the teeth. Well, it was very interesting for a 15 years boy to be operated looking, there was no pain, was very good anesthesia, and so it was my decision to become a dentist. And later on, after I had been a dentist, and I was very young when I finished, I was 22 years, and I tried to get a job as an assistant in a practice. I said, no, if you would stand here, my patient would leave the practice, for you are too young. I looked maybe as 18 or 19 years boy. And so I decided to go on with my studies. For this was the only chance for me to get some money, for the government paid for me. A little, very little, but so I could go on my studies and I could finish my medical training too. And this is why I'm a medical doctor too, not more. And later on, I was very much interested in surgery, maxillodental surgery. And I was promised to get a place at the hospital, but the professor said, wait for 3 months. After 3 months, you will get the place here. And this 3 months, you might go to an ENT clinic. For it's very important for us to have a man who is a little trained with sinus surgery. And these 3 months in the ENT clinic, at last we had 5 years. And so for at that time when I came to the clinic, the professor after 3 months was sent to another, transferred to Hamburg, it was in Berlin, and he went to Hamburg and took 5 of his staff, of his crew with him. And so we were a very little crew left. And all said, please stay here, for you already can do sinus surgery, as you are a good dentist and have learned maxillodental surgery. Please stay here. So I did, and therefore I now am an ENT doctor. So many things in our life only happen, as I used to say. And we have to take it as it is, and I think there's some meaning in it, isn't it? For now, again, there was a very hard change for me when I had realized that normal treatment, you know what I mean with normal, in ENT really can make our patients suffer a lot. I have been in many sinus operations, sinus punctatings, and I really can say now that I have learned in many years training by acupuncture, by homeopathy, to avoid all these hard methods. I have not been operated now sinus in the last 6 or 7 years, and I could avoid it by all these methods. And the worst is that no ENT doctors will believe in it. Dentists, just now in Germany, and as I say, also here in the States, I'm very glad to say it here, there's so much open now for new ideas, for new methods, but ENT doctors, very difficult to interest them in such new field. And so I have began teaching young students and young doctors that are not ENT specialists in how they can treat sinusitis. So they need not send their patient to my colleagues. What may I do? I can. It's hard to say, but it's the truth. So maybe that also you can get some ideas how you can help your patients that have sinusitis troubles. For this was my special field to do all my work in the oral cavity and in the pharynx, in both my professions. And so I more and more, when working by neural therapy, I used to do the deeper injections, to come to the nerves, infraorbital, trigeminus, or in the ganglion pterygopalatinum. There's special methods to get it by the needle. And I had seen that many of these patients didn't like it when I used the very long needle, and I had to control the situation of the needle by my fingers. And using the fingertip, I realized more and more that there are sensitive areas in the oral cavity, especially when I tried to get this special technique inside the mouth to get the ganglion pterygopalatinum. So I've had more and more that the region of the wisdom teeth and much more the retromolar region behind the wisdom teeth in all cases of sinusitis, patients are in a high degree sensitive to pressure. And I realized if I did the normal treatment, if I gave the patient chemotherapeutics, antibiotics, and all this treatment, the patients were free of symptoms, but the areas still were very sensitive on pressure, sometimes more than before. So I realized there was something wrong. and I began to give injections in these areas that were so highly sensitive. And now my patient came and said, oh, now I feel good. And they had much, much less relapses. In former times I gave antibiotics to my patients, they were cured, but not cured. They were free of symptoms. And after 3 or 4 months, they came again, they had the same problems with their sinuses, same treatment. Another half a year, they came back again, relapsed again. But now after using these injections inside the mouth, that you as dentists can do in a very simple way, I think that most of my sinusitis patients now can be cured. Maybe not only by these injections we can talk about later on, but these injections are very important. That can be stated. So when I had these results, there were some more stories about it. I remember one patient, I did this treatment, and I used to say patient to stay lying in another room for about 10 minutes, quarter of an hour, and I like to look at them after the time, everything okay, so you can leave now. So he said, what did you do with me? Why, what is the problem, I asked him. Say, I can move my shoulder, I couldn't do it for many months. I didn't know, I only had done the normal treatment in this oil furnace. And so he told me that he's a German tennis champion, I have to tell you. And I didn't know it because I don't play tennis. And he had been suffering it in many, many years. And as he was a famous tennis champion, he had many, many appointments with famous orthopedic doctors, professors, not only in Germany. He went to London, he went to Paris, he came to Australia, he went to the Philippine healers. He tried everything to be free with his shoulders because it was his profession, to play tennis. And after I had given him this injection in the mouth, he said, first time I feel totally free. So I realized there might be something special with this problem. And he's free now for a long period of time, and he sends me now many other famous tennis men and women. And so I see it's a very good method you can do in dentistry. For it's so simply done, and I have learned that this technique to have this injection inside the oral cavity in the mucous membrane is not at all a problem for dentists. But our doctors, physicians, they are very reluctant in using this field. Maybe it's not the right length to look inside the mouth, maybe not to be familiar with the field, and so I have seen the best to teach this method are dentists, because they really can help the patient in some or the other cases, not in all cases. You know, it's no method which can help in all cases. You have learned yesterday also, Dr. Kramer stated it, sometimes we have wonderful methods, sometimes it's difficult, and to combine methods, I have learned, can be very helpful in this case again. But this, to introduce you that our oral cavity, the maxilla, mandibular, also the sinuses, the tonsils, all this field of dentistry and ENT is this field where most of our focuses, or foci, give problems all over the body. You know that 80% of all our foci are situated in the head, tonsils, face, and so on. But if it is such a difficult problem with the foci, we can be glad that in the oral cavity they also have a field for treatment, which we didn't realize before. And why we didn't realize it before? Chinese doctors, they knew about 2 points in oral cavity situated below the tongue, no more, in the ancient traditional acupuncture. And we as dentists, if we use injections for extractions or dentist surgery, we put our needles
towards the root apex. But I have to realize that this area is not in many cases the best area for treating. For treating in this meaning that we now will discuss it. And therefore we have to realize that points, special points, treatment points, acupuncture points, trigger points, however we may call it, that these points are situated in the oral mucosa, inside the lips, inside the cheeks, at special areas, and these areas very often are sensitive when you are palpating. And this palpation we had never done before. Only we had supported our finger when boring in the mouth, but if you begin to palpate, you will find that there really are specific areas that can be sensitive to pressure, to palpating in a high degree. And therefore, it takes only 1 up to 2 minutes to have this palpation. And I have learned in my ND praxis to palpate every patient, each patient. I have done now in about 15 years. And these were thousands of patients. And so I have learned the sensitivity can be changing. It can be more... Can vary. It can be right side, left side. It can be in the upper jaw, in the lower jaw. And there are specific areas which nearly in most of our patients are sensitive, so we have to not to take it too seriously. And there are other areas where very seldom in normal state this sensitivity is to be found, and in case we find it, we have to take it again very seriously. That means something, and so we can compare left side, right side, upper jaw, lower jaw, and so we get some informations. But again, think what Dr. Kramer explained to you during his 2 days of wonderful teachings here. We get hints, for we are in a functional field. Functional work in medicine is quite another one than the orthodox medicine. In functional medicine, we have to learn that diagnosis and therapy are not totally separated as normal medicine. Just a fortnight ago, Professor Lüscher from Switzerland is a man with a color test. You may have heard his name, for his books are translated in 17 languages and goes around the world, this specific color test to test patients. He is a psychologist, and he has now developed a new method of psychology. He calls it a Funktionspsychologie, a functional psychology. And he asked me, what do you think about diagnosis therapy? Where's the one and where's the other one? So I say, oh, difficult to say. In many cases I say, it's really open, that diagnosis also can be the beginning of the therapy, and vice versa. Yes, he says, this is my meaning in many years, also in the functional psychology. So really, if we begin with measurements, as Dr. Kramer did, if we begin palpate, if we do something on the functional field, it's not only, we begin with a diagnosis. It is not such a hard diagnostic, which is such as diagnosis in X-ray, in sonography. There are functional diagnoses, and functional diagnoses are in a way hints. And hints, they are valid for this day, for this moment, for this patient in this state he has today, his condition for this day, or whatever it is. But it gives me the approach to the patient for the treatment that can be done now, and maybe, or to develop an idea in this functional field. Again, this palpation you might do in your practice. And yesterday there were some questions about the patient we had here. You had a little impression how I did it. It was very quickly done. Or again, if you have a patient with a dry socket, as it was asked yesterday, you can have these injections at the area which is not so near the root apex, which is more situated to the cheek or to the lips, and as it is a system on its own, all over the oral cavity, a system which we call a somatotopy, and we will talk about it now. So you also can use same point, or the analogous point, for this area that is in trouble, dry socket, or another wound, or whatever it is, on the other side. Or the same analogous area in the upper jaw, if it is a problem in the lower jaw, or vice versa. For all together, it's one system. And you meet corresponding points several times in the oral cavity. And that gives you a lot of help. For instance, you have a very swollen wound after operation of the wisdom tooth. You can't give another injection at this field if they have this field of pain and swelling. But you can do it on the other side. You can do it on the other jaw. And learn it that your oral cavity gives you lots of places for treatment by this analogy system. Now, first we talk what it is a somatotopy. You know this picture. This is the homunculus, as we call it. Homunculus, he has the same word, I think. And this homunculus, as you know, is in the central brain parts. The left side, the right side, the motoric one and the sensoric one. And we know that the human being with its different organs is projected in these fields in a special way. For example, the thumb is a very big dimension, and other organs not so big. Look again the oral cavity in a very, very big dimension again. And other organs, lips, jaw, tongue, and so on. So we know by neurosurgery and neurophysiology that this projection is to be found, and it means that all functions, all parts of the organ in the motoric meaning and in the sensoric meaning is projected at special parts of our brain. We know it. It's a normal knowledge in our medicine. And this was also called a somatotopy because the body in its parts is projected as a whole. So that the word somatotopy means the projection of the body at a limited place. It's at a circumscribed place. And you know something about the ear and the ear acupuncture. Again, we will talk about tomorrow. Again, you know, all our body projected at the circumscribed field of the body, in this case, on the auricle. On the earlobe, no, earlobe is this. It's the auricle. Is it? So, only to have this word, other word on it, other begriff, other definition may be a holography. Holography, you know, in technical terms, means that all this projection is like normal, but only in another scale. And this is not true, for the projection is not the normal man in another scale, isn't it? Here is the head, and here are the legs and feet, and so on. I think a better word on it is a microsystem. And I like to use the word microsystem, in spite it is not usual in German language. I've learned it in English. But microsystem, so we know, it is such a somatotopy, the projection of all our functions in a circumscribed part or field of the body, like of the auricle, and the same we have learned by Dr. Kramer, by Dr. Boll, is with the correlations of the teeth that are corresponding with all our body. And remember, Dr. Kramer said this wonderful definition yesterday. It's not only a one-way, but it is a two-way system, a circulating system. It goes in both ways. And so it was for me a very great advantage that Dr. Kramer and Dr. Volk, when I stated these findings as points, treating them in the oral mucosa, that by their researches, the correlations between the T's and the organism had been worked out already. So I now could have my experience to say, is it the same or get I other results? But it was very fine to verify what they had found for the teeth. What they had found for the teeth, I now could, by my injections in the oral cavity, in the mucous membrane of the lips of the cheese, I could verify what they had found. For Dr. Wall especially is interested in diagnose, measurement, and then using his very fine methods, as Dr. Kramer showed and demonstrated, that we can then do a treatment necessary, maybe in homeopathic, maybe in surgery, whatever it is, but that we have another way to help our patients by injections in the very vicinity of this teeth. But again, this field is not, or in many cases, not the area around the root apex, but beyond it, beyond the replication fold, more buccally and more labially. And now I may have some slides about it. Could you understand my bad English? Wir sind eine kleine, eine ganz kleine Knochen. Das ist es. Again, the oral cavity, it's a schematically picture it, that you only realize this point situated in the lips and cheeks, and very well situated in front of the teeth. Yes, next. Come in. I think it will work in this way. Again, fine. Remember our, you say duplication fold? Then replication fold. Replication fold here is the incisors, canine, and here for example, a point in the line out of the canine tooth, and here may be a very important point. Now think of the dental correlations to the canines. I've learned yesterday and the day before yesterday that many of you are very well trained in electroacupuncture and acupuncture and have a very high level. So for me, it's it's easy to explain, and I have learned that many of you know much more about acupuncture as I know. Please give your help if you can do it, but you will realize that canine tooth is this one that is correlated to liver, to gallbladder, which also is correlated to hip and knee. So we have learned that this point, for example, situated in the line out of the canine tooth, can be very helpful when treating hip or knee problems. But not only this, but all the widespread scale. When you look here in the very fine outlined correlations, which we have to thank Dr. Kramer and Dr. Voll, they have elaborated. So you get, as I like to call it, an input to a functional circuit. You know what is a functional circuit? We talk in acupuncture about meridians, but meridians, there's a line of points that are like a change in a functional unit, but not only one meridian, but as it is in acupuncture, the law of polarity, two meridians as a coupled pair have to be understood together. A yang and a yin meridian together, they build up a couple, a pair. And this pair of meridians, in other terms, and I like to use these terms for our Western understanding and for our doctors who have a first look at us, it's better if we talk in cybernetic terms, and so we call it a functional circuit. And so we have a functional circuit that may be called the functional circuit of liver and gallbladder, and this includes so many joints and other parts, muscles and parts of the spine, of the thoracic spine, for example, here. And so maybe you can use these points for treatment. Again, we have to learn that in some cases, I did not at all succeed with this point in the point in the ear, for example, there's a special knee point, worked much better. In other cases again, I've not at all success with the ear point or with the points used in neurotherapy or in bodily acupuncture. And it was a point in the oral cavity that could help me best. So there's a problem in medicine. Each patient has his own history and needs his own pattern to how to be treated. And for us as we are dentists, it's in every case very important that we can use points within our field. For I've learned that dentists in Germany, it's the same here in the States, you can have difficulties with the government or with the doctors, other doctors who wouldn't understand what we do. If we, for example, as a dentist would give an injection into the knee or in the hip, as in your neurotherapy does, or would use acupuncture at special points here. But as long as you can use your own field, nobody can say anything against you. It's your treatment, it's your special field, isn't it? Mm-hmm. And therefore, it can be a very good help for you if, and now I again say what Dr. Kramer explained to you, if he would not tell too much to our patients. I have learned from a doctor von Schweinfurt, who on his bills then put up treatment of lumbalgia, treatment of sciatica, and the insurance sends his bill to the government, and the government, the medical government, and says, oh, what have you done? He's a dentist, he has treated sciatica, he has treated lumbalgia and other problems. He's not allowed to do, and now he will be accused for it. As long as you only treat right on your bills or in your papers, you have done a treatment for the canine teeth. Everything is okay. And you know, and the canine teeth, as you know, is the input for quite a functional circuit. The functional circuit of liver, gallbladder, and so you have to learn something about acupuncture. I think it's necessary. And Dr. Kramer already had begun to teach it to you, and I have seen that most of you don't know a lot of it. Most of you know it, so we have not to go as too long in it. But so again, think of it and think of the connection that is done in both ways. I was very much impressed what Dr. Kramer said yesterday, because it's this I have seen in many cases. If, for instance, this area of this canine teeth would have a deep pocket, but all the other teeth, the incisor teeth, the premolar teeth, or the canine teeth on the other side, or on the upper jaw, they're okay. You have only a very, very deep pocket just at this canine teeth. Think of it, it can be caused by the correlation of the function of inner organs, now in this case especially liver, gallbladder, sending their impulses, expressing or manifesting the functional trouble in this area. For this area is included in this functional circuit. So especially if there are inflammations, if there are pockets that are so circumscribed that only one or two or three teeth are involved, but not the other ones, not on the other side, not on the other jaw. Think of it may be, not necessary, but it may be manifesting this connection of inner organs and the teeth, respective the tissue corresponding or belonging to the tooth, periodontal tissue, gingiva, and so on. Now, please give the next slide. Excuse us, we have a little problem with the slide. But again, you see that these points are not in the replication fold, but especially in the lower jaw and especially in the incisors and canine teeth and the premolars, these points are situated more outside. Now at this, I can explain another problem we have to realize. Not only this very area or this one point situated here can be helpful. For example, again the case maybe hip or knee troubles. You will, palpating here, sometimes find this area sensitive to pressure, but not necessarily. It can be painful, not necessarily. Sometimes you will find an edematous swelling. Sometimes you will find an induration, like small noduli. You know what I mean? You feel it on your fingertip. So when palpating, think of it, indurations, edematous swellings, they also can be a hint, but no more than a hint. And also if you don't find any sensitivity, you can use this area. In chronic cases, in very chronic cases, we have learned that not only one point in this line, in this correlation, is on duty, if you know what I mean, it is involved, but there come some more points up. But this is only in very chronic cases. And in this case, the other points are situated in this line. You know what I mean? So you find points near to the tooth and more out to the lips, but in the same line out of the tooth we just now talk of. Like a linear radiation. Like a linear radiation, like a beam that irradiates from this tooth, from the canine or from the incisor tooth. I especially like to tell it because in ear acupuncture we have a very similar phenomena, and we will talk about it tomorrow. So we come to some ideas to include it now, ideas about what a microsystem is and what a microsystem like in the ear acupuncture, like in the mouth acupuncture, how it differs from bodily acupuncture. In a way, there are points that we can call acupuncture points or reflex points. But the points in the microsystems, in the somatotopic systems, these points are reactive points. They only come up if there is an irritation in the corresponding functional circuit. In case of, in bodily acupuncture, you find your points as positive points. Positive points, that means the energetic flow through the body that is through all over the day, passing the meridians, stomach meridian and spleen meridian, and going next way again. These points are, in a way, they are present. Sometimes more present during the maximal time, as we call it, sometimes less present, but in a way they are present, they are on duty, as I like to call it. And as Dr. Voll told you, Professor Kellner of Vienna, who had this 1100 histological cuttings and found out that at the spot of the bodily acupuncture points, you in most cases find a lot of these corpuscles we call Meissner's and Krause's corpuscles, the fine nerve end fibers. And in the ear, where we have hundreds of points, this is the oral cavity again, it is not so sure if it are so much nerve end fibers at each area. But the phenomenon is again that if the inner functions correlated to this specific area of the ear or the mucous membrane of the mouth, if this sends impulses because of the functional trouble to this area, it will give special changes. And the changes here, they are again the same as we find in bodily acupuncture. Think what Dr. Kramer told you. There are changes in the skin conductivity for electrical current, the electrical phenomena. You have a changed resistance. The resistance is changed, and other phenomena are changed too. For example, the temperature. The temperature in many, you have a very, very fine thermography and fine instruments to measure the temperature. You will find that the points change their temperature too. And so there are lots of changes in temperature, in electrical behavior, change of sensitivity, change of many factors at the point in both systems, in bodily acupuncture points as in the microsystem points. But remember again that microsystem points are reactive points that only come up if there is some trouble. And so it can be very simple controlled if this system is a real one and how it works. And this research has been done by Russians. I will give you one picture on it. It was a research from Professor Portnov of Riga in Russia. Professor Portnov, and he did it with the ear of dogs and rabbits. And so he gave an injury, a trauma to inner organs, for example, to the liver here, or to the pancreas. And before he did, he had controlled the electrical behavior of all these areas. He checked if it was normal by his detective instrument. And as he had checked that it was normal, now he gave the injury to the inner organ, for example to the pancreas, and half a minute later he checked again all the areas of the ear of the rabbits, and now at special points a change took place. A change in the electrical behavior, a change in the thermical behavior, and if it was stress for a longer time, also a sensitivity could come up. So he did it in many, many hundred cases with dogs, with rabbits, and so he found out that there are specific areas for the pancreas, for the liver, for the heart, for the kidneys, for the genitals, for all our inner organs and functions in the ear. And Professor Durinyan from Moscow, he did the same within the oral mucosa too, and especially with the teeth. He had researches in giving irritation to the pulp, and this pulp irritation he could measure, gave impulses to the nuclei of the trigeminous nerve in the part of the medulla oblongata, because some of the nuclei of the trigeminus are going down to the medulla and are there situated, and they can be controlled in these cases. And if you put another impulse at another point of the body, as a body acupuncture point in the oral mucosa, a point that could be in a connection with a special tooth, again, then the impulse of the irritated pulp was overlapped. It was overlapped so that he could give the same or similar results as done here by Professor Polknov. So we know that scientific work stands behind all these phenomena we have to realize in our work. Durignan. I met him at Beijing 2 years ago. He's a wonderful man. And just now, 2 weeks ago, I had to hear that he died in a heart attack in January. He was one of the best research men we had in Russia. He was a man about 55 years. I was very sorry to hear that he died in a heart attack. So we go on with the slide, please. Now we had talked about the points near the teeth, but please realize that not only the vicinity of the teeth may have special points, but that all the oral mucosa can be such a specific area, and the difficulty is we can not so clearly differentiate in this area. By palpating, I would suggest, and I have done it in many hundred cases, that if you palpate the lip and the cheek and you go on in this area, you come to this what we call the linea obliqua. What is it in? It's right, linea obliqua. This is the bone edge of the ascending mandibular. The beginning bone edge of the ascending mandibular, you know. And so palpate by your finger this edge and go up with your finger at the ascending mandibular up nearly to the temporomandibular joint. So you will find other points that not can be connected or correlated with the teeth, but points that can be very helpful for treatment too. I very often am asked in this case if not all this area near the TMJ and in this area where the muscles or chewing muscles are very strong and very in tension, if it is a symptom of tension, of bruxism, for example. Patients who have such a hard pressure to stand that these points may come up. And I can't give a better answer than if it is a trigger point in this case, or if it is an acupuncture point. It's difficult for us to differentiate it, but the treatment, in my opinion, is the same. And therefore, if you find the points, and you find this area is a trigger area of the chewing muscle, and before you begin to have eine Schiene, eine Aufbisschiene,
Eine Aufbisschiene.
if patients have
Dental appliance.
a little,
Or orthotic appliance, I mean a
yes,
dental.
the very plain
Splint.
split. If you, because of gynecological problems, you have the split for your patient. Please first treat the trigger points. I have learned by friends of mine, dentists, that are very much engaged in gynecology, that they have learned first treat trigger points inside the oral cavity, some may be necessary outside, near the TMJ, and in many cases the problems are gone, and you can help the patient without the split. In other cases, maybe 50-50, you have to do some more very good work in gynecology by using a split or by slitting the teeth or whatever you do. Equilibrating the teeth and do the gynecological work. But think, if it is sensitive on pressure, it gives you the hint that the patient is hovering on it. And why may our patients suffer if by a little injection we can give a help? This area, to say some more about it, I have learned in many cases in terms of acupuncture is correlated to that what is not to be found in our dental correlations chart, the correlation to the triple heater or triple warmer of body acupuncture. For I could check it in this way, that we have endocrine points and areas in the auricle. And I have learned in several cases that if I treat this endocrine point in the auricle, these points in the oral mucosa are relaxed. Not disappear, but they are relaxed. Fine. Or vice versa. If I treat this area, the points in the ear correlated to the endocrine system can again be relaxed. Not in every case. There's a difficulty in all our fields. Some patients, or some cases, you can realize it. In other cases, it may be other correlations. But think of the triple warmer in this field. Again, next.
Sorry.
It doesn't matter. Now no, it's okay, thanks. Now, you know, this area, we call it tuber maxilla, tuber maxillare, or a very good definition on it is a 9-tooth area. I think you have used it here too. Is it? It's the end of the alveolary processus, which gives such a big, what is it?
We call it the maxillary tuberosity.
Yeah, the tuberosity. And you can realize that this area in the oral mucosa is the most important for treatment, I've learned. This might be a wisdom's tooth, don't count here because this patient is only 70s. But the wisdom's tooth area and the connected area that we can call the tuberositas area or the retromolar area, this in a high percentage of our patients is sensitive to pressure, in a very high degree. And in all patients, as I told you, that are problems in sinus problems, bronchitis problems, and also all problems in the large intestines. This was for me as an ENT doctor the most important combination to realize that all problems in sinuses, all problems in bronchitis for example, that we can't understand this problem without including the large intestine. Acupuncture knows about it. They have said lung, large intestine, that's a functional circuit. They work together, they are a combination, they are correlated to each other, but how to explain to an ENT doctor that he would understand it? It's really difficult. You only can understand by experience of many, many years that you see, if you do something for the bowels of your patient, if you treat also the bowels by acupuncture or by change their nutrition or by other ideas, they overcome the problems with sinusitis and bronchitis and whatever it is. But we really have to learn, as it is in bodily acupuncture, a specific area which nearly in all men in civilized countries are very high sensitive. Think of this area. You may palpate it on your own. It's the area of the point that we call large intestine number 10. You take the elbow and about 2 fingers distantly of the elbow, 3 to 3 fingers. Look at my wife, she will demonstrate. You will find on the biggest part of the muscle, on the biggest bones of the muscle, you will find and have a little hard pressure on this point. Have a little hard pressure on this point, and you will find that most of you will be painful in this area, isn't it? And when I came to Asia, I said, now I will prove these patients too. And I think they're not at all so sensitive in this area as we are. You have been in Asia. Have you controlled it? They're not so highly sensitive. It may be that is really a symptom of civilized people. Our nutrition is not at all normal, as we know, and so in all civilized countries we may have this problem, and this problem is a problem of our microflora in the bowels. A problem that we can call
Dysbiosis.
dysbiosis. You know this word. We call it in Germany eine dysbiosis. I think that dysbiosis is one of the most common problems in all civilized countries now. And this dysbiosis is expressed also in this area. And you can control it also by this point. You can check it by this point here. So think of this area that it will be in a very high degree of all our patients be sensitive to pressure.
Is that actually the tuberosity or is that the hamular notch?
It's a notch here. It's the ninth tooth area, but most on the buccally part and the distally part. Sometimes you have to go also to this area, a little to the palatinal side. For again, demonstrates this area, patients with shoulder complaints. As I told you before, I have learned for treating of shoulder complaints, this area is the best. Better than all points in the ear, better than all points of body acupuncture. And you can have a try in it. But we have to find the points very precisely. And this is difficult in the oral cavity. And this is especially difficult in this area. Either you can say the patient as done in this picture, open your mouth as wide as possible, and then you can take a very fine needle, this is only a very big one for demonstration, and then touch the mucous membrane in this area, and you will find points sensitive when touched by the needle. I use normally another way. I only give 1, 2, 3, 4, or 5 quaddles. You say quaddles?
Quaddles.
Quaddles.
Wheels.
Bubbles.
Wheels.
Wheels.
W-E-A-L-S.
W-E-A-L-S. Or quaddles is the right word.
Yes, wheels. Wheels of, but you would understand quaddles. But you can give this superficial quaddles at this area. And patients sometimes, if I began with 1, 2, 3 quaddles at this area, now they say, oh yes, now I can move my shoulder better, or my elbow, whatever it is. And I ask them, please, have this movement, or that movement. So now, it hurts. So if I go on and look for some more points in this area, and pause one or fifth one, and have another try. Now, have this movement. In many cases, now it's better now. So, be not be disappointed if 1 or 2 points are not enough, and not 10 or 20 points. But realize that all this area, the circumference, the surrounding of this tuberositas, of the tuber, you can look at this area and give 1, 2, 3, 4, 5, maybe 6 such quaddles in this area to get all these correlations that are necessary to cover all these meridians. Think on the shoulder. The shoulder, you have the meridian of the large intestine on the front side. There, on the back side of the shoulder, it is small meridian, and in the midline of the shoulder it is triple bone. Okay, thanks. Get it, please.
How many millimeters in
Very superficial. The injection had to be done very superficial. We talk about later on that. Fine that you said. Not at all deep, and very low of the liquid we use.
Could you go a little bit more into the palpation technique that you use to
Yes.
find the places?
I think we have to exercise it later on.
Okay.
I think nearly the best. When demonstrating it, there come up much more questions about it. And so we will think. Yeah.
This point's usually buccal to the tuberosity or on the tuberosity?
Yes, both. It can be on the tuberositas It can be on the tuberositas, but in most cases it's the edge. It's the edge of this tuberositas. But think of the tuberositas itself too. But again, if we talk about our results, please understand that not every of our patients can be cured. We have to say it. There are patients with such old periarthritis, with so much changes in the tissue, that it wouldn't help if you do it. For you as a dentist, it may be that you in many cases get the patients on an early stage, because they don't come to your treatment because of their shoulders. They may come for pain in the mouth, or for their troubles in their teeth. And if you see that they have a bad movement of the shoulder or whatever it is, or if they have sinusitis problems, bronchitis problems, if they have elbow problems, tendovaginitis problems, it's the same area that can be treated here. And you can have a try. And the best is, again, you do it in your own field. You don't talk about what you have done if the patient is cured or improved. You will be glad, your patient will be glad, and you don't, that's not rechnen, you don't
charge for it.
You don't charge for it, but the next crown you do, you can charge a little more.
You can charge for anesthesia.
Yes,
Or
yes.
trigger point therapy.
You can charge for it. Is it allowed?
That's legitimate.
Yes. I think you will not have problem with charging anything. But more important than charging anything is to help our patient, isn't it? So, what do we do?
You can see Gary for the code numbers. Has them all.
Maybe that in this palatinal area, maybe also very important point. But I'm honest to say that I don't like to use it, and you know why. Because it's so sensitive if you give your injections here. But if you use this area, and especially the technique, which only can be done by dentists. No medical doctor has learned this technique, but dentists can do it. That you first have the palpation in this area, and after you have palpated it, you say to the patient, please close the mouth again. Not totally, but so that only a little distance open. And then you put in your needle, or you had done your needle inside before, and then you say, close again. And now you put the needle through. The patient doesn't feel it. In this area, he really doesn't feel it.
So
In most cases.
The dentist has his eyes closed.
Yeah. You not necessarily have to control it by your eyes, you feel it. Because I put here at this spot my fingertip, and the needle glides under my fingertip, and I can control. I check my needle by my fingertip, and if the quaddle goes up, if the quaddle gets like a bubble, it's okay. If it doesn't, what has happened? Too deep. So you can control yourself if you are superficial enough. If you get a bubble, it's okay. If you get no bubble, you're too deep. If the bubble is too big, you didn't know good work. Have a little bubble. Have 2, 3, 4, 5 little bubbles and control it by your finger. Check it by your finger and have the mouth nearly closed. Only such a little distance, so it can be nearly painless, especially in this area. And you know we have so many patients that are so in a high degree sensitive for each injections. I have learned that in these cases, I begin all treatment in this area. Whatever I do, treatment of the tonsils, treatment of the sinuses, treatment of the nose, whatever it is, I give them first injection here and let them go again. The next time they come in my practice, they are no more afraid. They have learned that injection can be so painless and doesn't harm, doesn't hurt. So you have a field to train your patient to overcome anxiety. I think it's very important for us, isn't it? To train this patient, we have to train them. I remember a patient who had sent to a Kur, to a spa for 4 weeks by the insurance. He hadn't to pay anything. In Germany, we have a social system that everything is paid for this month for the patient. But the patient returned after 2 days because he had to be injected by the doctor, by a blood probe and yes, and some more. And so he said, no, I'm so afraid to get any injections. And so he returned home again.
Cancel it all.
He canceled it, and he could never get it by insurance in another case. And 5 minutes later, I had done 3 injections with him, and also here in the venous. No problem. So, next.
Habe ich die jetzt falsch?
Then sorry. Now we have another one which gives you the same, only that means that this point on this chart here, this picture, not necessarily are the only one. They can be here in the middle. Also now the lower jaw area is included. Again the 9-tooth area. In the lower jaw we talk about the trigonum retromolare. And again the points are situated in the wisdom tooth area and behind it in the 9-tooth area on the buccally side, on the lingually side, and again distally.
Willst du zu der Patientin was sagen, in diesem Punkt?
Vielleicht erinnere mich nachher nochmal, thanks. And so the points can be at different areas, and if you had palpated the upper jaw and you palpate the lower jaw, you have to know that in this area of the lower jaw, the sensitivity is never in the same degree to be found as in the upper jaw. It's a rule. I can explain. Maybe the same as we said here with our large intestine number 10. That the correlation to the large intestine is more expressed in the upper jaw. In the lower jaw, please realize that your palpation may not be so successful. But you can use another technique to detect the points. And that is better in the lower than in the upper jaw again. So you have another way to find it. In this area, especially on the buccally side, the tissue in many cases is so soft that if you touch this tissue with your needle, and nobody can do it better than a dentist, again because you have your hand supported. You have this very fine hand which only moves 2 fingers and the other fingers are supported in the vicinity, isn't it? If I teach it to the doctor, he will do it in this way. So it's painful for a patient. Yeah. So if you touch this mucous membrane in this area, some of these areas or special points are so weak that you have the feeling as if the needle would drop in a channel. There's no resistance. If you have a fine needle and you touch, and at some spot the needle is being attracted. And in these areas I have learned during the years I have done it, these are the best points. Use only these points when the needle really is gliding like in a channel, is attracted, and you have the best done for your patient. Now if we consider this area in the lower jaw, area of the 7th tooth, wisdom tooth, area of the retromolar region, we have very good opportunity to treat spine troubles. Lumbar spine, thoracic spine, sciatica, in this area. I've seen lots of patients during the years when they came and couldn't go, couldn't walk, and had pain in the lumbar area. I first had palpated here and gives them some points in this area, very superficial injections again, and they had a free movement or improved movement. You can do the same by the ear. We have learned it. But for the dentist it may be interest to use the oral cavity better than the ear, isn't it? But remember, in some cases it doesn't work. And in such cases I like to have another try at the auricle, and maybe it works better if I use the auricle. In other cases I have to treat directly or according to the principles of bodily acupuncture, and there are other cases where nothing works, where nothing helps. They have to accept it. But if you have a try, first done in this area, again, it is the 7th, 8th tooth in the lower jaw and the area behind. Nevertheless, upper jaw if it is sensitive. Begin in the upper jaw, in the area of the tuberositas, if it is sensitive too, because from my experience, I have learned that this area is a key area for all sensitivity in the oral cavity. For example, if you will find points in the lips sensitive to pressure, maybe here situated near the inside the teeth. If you now treat first the wisdom tooth and retromolar area, many of these points disappear to be sensitive. I cannot explain why. Same in the upper jaw. If you first treat the retromolar region, wisdom tooth region, and if there has been a sensitivity at the premolar or the canine or the incisor area, it in about 50% is released in a remarkable percentage. That the patient who had a very sensitive feeling before when palpating, after he had done this treatment first, he says, yes, there's a very strong release already.
Also die Diagnose ist hier besser.
Yeah. You diagnose by palpating all the oral cavity. But you treat first in the retromolar region and wisdom tooth area. That is experience. Think of Dr. Kramer, we have to tell about our experience. We cannot explain why some things are in this way to happen, but the retromolar area, according to Dr. Follows, it is like an energetic centrum of the body, and after my own experience, not only the somatical impact here is so centralized and so important, but also the psychological impact. Think of all our patients, the patient we had seen yesterday, we will say once more today, all patients which suffer on psychological problems too, or on the first hand. Think of this area again. I have learned that my depressive patients, in most cases, they are sensitive in the retromolar region. So, together with other points of body acupuncture or ear acupuncture, I used to include this area for all patients with ill conditions on their psyche. May not be a depression, but other conditions, but you see that many of our patients during the last year, much more than before, come with symptoms that are very unclear, that are non-typical symptoms. You know what I mean. In former times, I remember 20 years ago, as an ENT doctor, the patients, they had very hard symptoms. I knew what it was. I could do my work as a doctor or as a dentist. But now so many unclear symptoms come up, non-typical symptoms, and you feel there's something psychological included in this patient. And in these cases, maybe it's not so bad to begin first to build up the bodily and the energetic balance, which also is a psychological balance. You can't separate it, you can't differentiate it. The energetic balance for us is the same as our psychological balance. And if you can build it up by some point before you give your surgery or other hard treatment by sleeping or boring many teeth for bridge, for example, it might be better.
Do you balance all four retromolar area, or just one, or two?
In every case, both in the upper jaw, but if necessary, all four. Upper jaw, lower jaw, right and left. As it is a balancing system, and as we have the polarity within us, and we will talk more about polarity tomorrow, about right brain, left brain, and all these problems that are included here. I have learned it's better to give treatment on both sides. Also, if one side is much more sensitive, or is only the sensitive side, the other one is not sensitive. A balancing system is better to give impulses on both sides. I used to compare it with this, if you think it's, what is this?
Eine
Balance
Disbalance.
or teeter-totter.
Good. If this is out of balance, you can have two actions. You either can lift it up here, or you can press it down here. But what works best? To do only a little here and only a little there, is it? If I have only here, I have to do it hard here. And only here, I have to do it hard here. But 50% here and 50% there is better. And therefore I like to say, therefore I like to give my treatment in bodily acupuncture as well as oral acupuncture on both sides. Have it on the right side and have it on the left side. It will help to restore the balance. Is it? Very simple model, but I think you will understand what I mean. If we look here at this chart again, we say that there are points situated on the lingually side too. And this is an area no doctor, no physician is able to treat it, only dentists again. I will tell you some cases where I really think that it can be a good help. It is also in troubles with our oral genital system and all that belongs to it. I remember several cases also with patients that were suffering from colics. Colics, you say colic? Colics. And when they came to the hospital because of this pain, they couldn't find stones or very small grease, what's very fine sediments. But the pain persisted and was only to overcome by opiates. And if I gave injections in this area, the colics, the tension in the oral genital tract, wherever it was released or gone. So think of it that this area can be helpful also in oral genital conditions. Dr. Beisch of Germany, who is a very good electroacupuncture doctor, he likes to use this area of the, he found out that this area also is connected very much with our genital system, with the kidneys again. So we have to learn that all these connections at the side of the vestibular points, they are clear. And they are, as they are to be found on this wonderful chart, we have to thank Dr. Kramer and Dr. Boll. But in the retromolar area, it is very difficult to differentiate. It's too much accumulated. There are too many correlations that overlap one another. So only by experience we can say that in the upper jaw again, all problems where the intestines are included, think of it, and in the lower jaw again, the genital system where it is included, think of it, but the spine, especially also the cervical spine, and the cervical spine may be most included in your problems. The cervical spine best can be treated by combine these two lines. I will have another slide for it and show how you can treat cervical spine troubles. For this really works quickest and best.
Have you investigated the soft palate?
The soft palate? Yes. Dr. Arana asked for the soft palate. And you know Dr. Honigge of Germany, as a neurotherapist, he recommended injections at the upper pole and the lower pole of the tonsils, of the arcus palatinus. And by this dabbing technique I told you, dabbing, can you say dabbing technique, you know what I mean? The dabbing needle? Would you understand what I mean?
Using the tip with
The tipping.
rounding movement.
The needle which is sitting on the tissue in a very gently, very soft way. Tapping. The tapping needle. Maybe? I have found out that in the middle of the arcus palatinus, there's very often a sensitive area that had to be included. Also, if I would use it as a neurotherapy, not only the upper and the lower pole of the tonsils, but very often in this area which is very close, very near to our ninth area, to the, that you mean, is it? Yeah. That you may include this area. And it's no problem for a dentist to give injection here. It's not normally for you, but nothing can happen. I think that's really the best of this reflex therapy with the oral acupuncture point, that I never have seen side effects. The only side effects that can come up is that dental focus can be activated, can, it can
Become acute.
Yeah, can be acute, and why not? It may be good for us to realize what it is. But as we have such superficial quaddles,
Yeah.
Wheel.
Waddles.
you really cannot have any problems if you also have injections here near the tonsils. But please don't touch the tonsils itself. Keep out of the tonsils.
Are you at a point where you can conclude, so we have a few announcements and things to do before the break?
Du sollst jetzt zum Schluss kommen, vor
Ja,
der Pause
ja.
will noch was
Yeah,
ansagen.
yeah, good.
Why stay out of the tonsils?
Warum die Tonsillen nicht berühren?
I have learned if we give our injections directly in the tonsils, it can give an abscess. The tonsils are full of
Toxin.
toxins. They are full of. I used to pressure out the tonsils in each of my patients
To drain them.
to drain them. And if you see what they,
Comes out of the tonsils.
what is coming out of the tonsils, you would
Understand?
understand that it's really dangerous to give injections within the tonsils. And I have also the impression that all this tissue that is so important for the thing of the regulating, the basic regulating system we talked about yesterday, that all what is a vaso component, or which is a neural component, or all these components for the nutrition of the tonsils, you can get it in the surrounding.
At it.
You can get it at the surrounding, at the arcus palatinus tissue. And it's, for we have a regulating therapy. And by a regulating therapy, it's not necessarily the organ has to be touched, but all this which nourishes it by nerves, by blood vessels, by lymphatic flow, which is a supply for the organ. If we open it by this way, I think it helps enough. Would you agree?
I don't know.
Question? In the urogenital area, where you're talking about before, where you give your injections, would that help with menstrual cramps?
Würde es auch bei Menstruationsproblemen helfen, zum Beispiel? So?
Yes, you can have a try in it. For many of these disorders are in a way a spasm. And spasm in the orogenital tract can be released by this pulse. Not in every case again, but I have seen good results in it.
The mid-tonsillar point that you pointed out is important. What do you use that for specifically?
Der Punkt am mittleren Pol der Tonsillen.
Yes, look at this area, the nintus area, especially on the lingually side, but maybe also a little to the tonsils, as you give a very good question with.
For what
This area.
Was ist die Indikation für diese Gegend?
Again, problems on the one side, the orogenital tract, but if you treat the cervical spine, I have to include it here, you have to include this area too. You have to include not only the buccally situated point, but also 1 or 2 or 3 points that are situated more lingually or palatinally. I've seen especially for movement that turns the neck. Sometimes you get this movement by these points here, my buccally points. But if I ask my patient to turn the head, he says, yeah, no, it hurts. And I give another injection here, more on the lingually side or on the, near the tonsils, and now he says, no, it's okay. Now I can turn my head. Okay?
Yeah. Okay, I can see by your faces that you're not enjoying this. But I think we're going to invite him back anyway.
There's a few announcements. The first thing I'd like to do is have Dr. Irwin tell us about an interesting situation that's developing. Doctor, please come and tell us, and go to the microphone and use that. And a couple more announcements after that before we break this morning, okay?
Last month I saw a 45-year-old man who, his background was quite interesting. He was a biophysicist for TRW in terms of space industry, and his background was in materials and electromagnetic forces involved in outer space. And 5 years ago he developed MS subsequent to dental therapy. And currently what's happening with that is that he feels that in the removal of his amalgams and treatment that way, that it saved his life, but there's still considerable arresting of the MS, but considerable difficulty in balancing himself and walking. He's not totally paralyzed, but he has a great deal of difficulty in thought processes and physical processes. So that the result of that is that he had told me that he's consigned Melvin Belli to taking his case. They've accepted the case to deal with the dental manufacturers on not having any warnings or precautions in terms of the materials, and that he has already put up $1 million of his own money to fight this case. So that the man is very committed to carrying this to conclusion. The patient that referred him to me was suicidal and depressed, a patient of ours, and her recovery from the amalgam removal has also coupled her with him in the case. She's not as financially well off, but the two of them together plan on pursuing this, and Melvin Belli and his associates have already accepted the case, and they're putting the material together. So that they plan on flying doctors in from Germany, whoever in this field can be witness, and other doctors who have worked with him, and hopefully dealing with this in a way that will bring the publicity that's needed to this problem.
Isn't that a sensational development? Well, they're going to get theirs. What goes around comes around. Okay, this is the book, The Body Electric. Every one of you should, if you're not familiar with it, should read it. It's very important information. Dr. Becker has consented to talk before this group, okay?
Great.
And he has a lot to tell us about electromagnetic pollution. And
He hadn't really thought about the role that the dentist plays in this, but I got him thinking about it, because I asked him a question. We have, if you want to know where to get that book, you can get that book at, why don't you hold that up there and you can focus it in.
Most bookstores can order it. It's listed in their catalog.
Bodie Tree has it.
the Bodie Tree, Shambhala, Fields Bookstore in San Francisco. There's the address on the screen now. You just phone in your credit card number and then mail it out to you. This is our seminar evaluation. We want you to fill it out. We want your comments. We want your direction. We want to organize this thing. So please get one of these and we'll pass them out. Tomorrow, please turn them in. We'll be in communication with you. Another development, we're going to offer all the tapes to the attendees for $40 a piece, which is really a good, we're talking about the videotape, which is a good deal. Because I want you to get this information, I want you to look at it. We're going to be passing around the list if you want to order any of Dr. Cromer's instruments, and possibly we're going to try to work something out where we can get the test kits available. You may have to personally write to Walla and bring it in, you know, and there are ways to do that. There are pharmacies in England and in Canada that carry these, and we will try to get the names of them for you if all of these shipments are starting to be stopped
by the FDA, and they just hassle the people about them. But there are ways to circumvent that, so we can start practicing biological dentistry here in the United States. I can't think of anything right at this present time, but if any of you have any questions.
Focal points are like put on a line, but not only over the auricle. You can sometimes find points spread more over the skull or over the face, and I have controlled in these cases that these points are not only at the surface of the skin outside, but they also are, in this case, inside the mouth. So you not only have to consider it as a line, but as a level. Did you say a level? A plane through the body. A cutting plane through the body. You know what I mean?
Microphone, please.
Yes, thanks. There's only to remember you once more about this phenomenon. And this phenomenon is as well in the oral cavity as well in the auricle, and this phenomenon in a way is typical for that what we call the somatotopy or a microsystem. And microsystems, as you see, have other rules and laws as bodily acupuncture. The points come up, the points disappear again, the points are not present normally, but they can be present for a longer time in chronic cases too. They are not part of an energy flow as we would describe and explain in bodily acupuncture, and in a way, for my opinion, the phenomena in this field, in the microsystem, have something to do with physically radiations that give such cutting planes. But we know not too much about it, and I think there's a lot to be done in research, isn't it? The results in ear acupuncture as well in oral acupuncture can be achieved quicker than in bodily acupuncture. But I say on the one hand, I have learned that deeper involvements, deeper energetic troubles, in many cases again can be better solved by bodily acupuncture. But for example, you have patients with problems in their joints, in their movements. It's very good to begin with the simplest. I, in my praxis, have the problem that I have too many patients every day to look at. About 50, 60 every day, and it's very hard to stand for me. And therefore I have to begin with this, which is the quickest method. And therefore I have learned to begin with ear acupuncture or mouth acupuncture and such possibilities. But if I have to learn that it doesn't help, it doesn't work, I have to go deeper, body acupuncture, pulse, once more the history of the patient, and take a deeper view over all the energetic problems that may stand behind it. And then again, in many cases, I come to the conclusion that now the patient had to be sent to a colleague or friend of mine who is an electroacupuncturist at Dr. Kramer, and he has to go on because I can't get it without measurements. So you see, it's like a step by step. We can begin with the simplest one, which is quickest done. And a lot of our patients may be helped by this method, but others not at all. And so we can take the next step. And if the second step works, okay. When it doesn't work, it's very good to have good friends who know another better method than you yourself are able to do. And therefore I am very thankful that in Germany more and more electroacupuncturists now are trained, and that they do their very good work. For to find out in such cases a focus, it's necessary to have these measurements. But you have seen yesterday it takes a lot of time, and you have to be trained very well to do it exactly. And therefore I'm so thankful that Dr. Kramer is here, for he really is one of the few who has this teaching with this exact approach to it. It's very fascinating. I remember when I came first time and was taught about electroacupuncture. It's a fascinating method, but to learn it you have to stand a very hard training. Very, very hard. But again, the combination of 1 or 2 or 3 steps you can do, in my opinion, is good to be done, and especially as you are a dentist and you have your normal work with your patient, normally you know what you mean. So you can try, for example, to use some of these all points. Now we have maybe some more pictures, and then we will talk about our patient. Yeah. I think we had talked about this enough. There were no more questions. Next one. If there are questions, we can talk tomorrow or this evening. Now only one of the lower jaw again. Does it work? Doesn't matter. If we think of the... Right. Oh yes, fine. This is a picture done by a friend of mine. He's an ENT doctor in Munich too. And he used my old points in many years, but he has much more patients than I have to treat every day. And he says it must go quicker as you do. And so he only has this method: opens the mouth, as we look in this shot here, and then he gives 1, 2, 3, 4, 5, 6, 7 or 8 such subepiphyseal injections without palpating, without checking before, or without a special technique like this dabbing technique I told before. He only says, opens the mouth, and he begins 1, 2, 3, 4, 5, 6, 7 points, but especially in all cases of cervical spine troubles. He is an ENT doctor. He had now a paper in our annual meeting for ENT society in Germany, where all the professors of the university are there, and he had a paper about this method. He didn't use the word acupuncture. He didn't use any special term we use here. He only thought it's a reflex area to treat the cervical spine. And he was accepted with this paper. I think it's good to know. If we talk about cervical spine, we have to learn that cervical spine is very much involved in dentistry as well as in ENT. For we learn more and more that all patients with chronic conditions in our field, that they are in trouble and in pain conditions or in movement conditions because of their chronic conditions in the tonsils, in the sinuses, or in our dentistry field. What we didn't know before about the cervical spine, that the cervical spine is so much involved in all our movements as well as in our equilibration. In former times we believed that it would be done by the inner ear. You know that there we have the Bogengänge, what's the name?
Cochlea.
Cochlea. The cochlea, everything is done for our normal standing and our equilibration, our balance. But researchers during the last 2 years, just now, in Houston, Texas, in connection with the space research, they found out, and there was a young Munich ENT professor who was in this team too, they found out that the cervical spine is the terminal nerve fibers in the cervical spine do as well for our equilibration, for our feeling how we stand upright or equilibrium, that is much more responsible, our nerve ends, our terminal fibers in the cervical spine. And so think of it that our nerve system, our fiber system in the cervical spine is so much connected and correlated again by the reflexes of our field. Dentist field, tonsils, and so on.
You mean vertebral spine, not just cervical. Cervical is just the neck. You talk about the whole...
Yes, but most is cervical. Most is it. But it's, you are right. It's all the spine, but most of it's the cervical spine. Again. I only know the name of the German one, but it was a team of Americans and Germans. But I give you the name later, maybe on the paper. So I think we have to realize that the cervical spine has to be combined or to be included in our treatment. I also have been taught by dentists that if you have a patient lying in this chair for many hours and you are sleeping for a bridge or have a hard work with a wisdom teeth for 1 or 2 hours, that the cervical spine is in a way stressed, like if you might have had a very a slight accident with your car. Whiplash, yes, this is it. It is nearly the same problems in the cervical spine. Because the patient, you know, he holds his head because he is afraid and he has to stand all the noises, he has to stand all the pressure, so he gives a lot of counter pressure. Can you say counter pressure? And this stresses the cervical spine, and it's for half an hour, it's no problem. But patients lay in this position for hours sometimes in our chest, isn't it? And so the cervical spine is stressed in a very high degree sometimes. And think of this point I just had shown in the last picture, that by this point you can, maybe in the next treatment, give the patient help to overcome his cervical spine troubles. Give him this 1, 2, again, if you begin in the lower jaw, this is the wisdom tooth of the lower jaw. Here, this is the area where I said with a dabbing needle or a tapping needle, you can touch it very softly, and the needle in this case is held tangentially, not vertically, not in this way. Tangentially by the supported fingers, and you touch it this area, and it is so soft that the needle drops in like in a channel. You have got the best area. And then you can go up the line, up to the upper jaw, and so this field may be the best to treat the cervical spine troubles, maybe in connection with our work we have done. And also again here on the lingual side, and think of this area, if we imagine a 9th tooth here, and that the 9th tooth had its apex, and we would give an injection to the lingual side of this apex. So we have a very important point again that we talked about in genital conditions as well as in cervical spine conditions. I think you can imagine. Dentists have no problem to imagine it.
Have you helped women with PMS problems by injecting that area?
What's PMS?
PMS.
PMS.
Premenstrual syndrome.
Yes. Yes.
Premenstrual syndrome.
Yes. You can have a try again, because this area, as you know, is correlated to the triple warmer, and triple warmer with its endocrine impact. And either by the ear points we talked about in the incisura, in the tragica, or have a try in this area. Thanks for the question. Yeah, you can. Then the patient may come here.
11:30.
Let's take that. Let us make this picture. This is one you have got in your booklet, and you can, in your booklet you will find 2 color pictures, have you, in the last page? And I think these are the most important ones. I could only put 2 of them in your booklet, but I think it will remember you. You have got it, fine. And in the middle of the booklet you will find the same one as this here. The only difference is that we have some colors on it here, and I think we need not talk too much about it because you have learned it. Most of you are familiar with this. Think of it that this shaft, with these projections, this is valid for the vestibular points situated near our teeth. Retromolar area is an extra part of the system of the correlations, and there we have not this so clear definition as it is done here in this chart. Now we think of our patients that may come in quarter of an hour. Please give the next. Shall you have it in your booklet? Now you get the same, only in another kind of order. You see again the kidney urinary bladder correlation, and you remember, if you have your chart, this is correlated to which teeth? Front teeth, in the upper jaw as well as in the lower jaw. But again, think of it that kidney and urinary bladder and urogenital system has another correlation in the retromolar region, remember, especially in the lower jaw. Liver gallbladder correlated to teeth, yes, and again, fine. And spleen, pancreas, you have it in your chart, and large intestine, there's the only crossing over, you know, that in the upper jaw and in the lower jaw it's not quite the same. We'll talk about it later on. And heart and small intestine meridians, or the functional circuit, and we can talk about it, of the heart and small intestine correlated especially to the wisdom states. Here we have listed that not only the meridians are connected to these 5 groups of teeth, but also sense organs. And as you know out of the other chart, special segments of the spine, special joints, and so on. But I like to mention here that also some psychological behaviors are included in our functional circuits. If you have learned traditional acupuncture, so you may remember that kidney and urinary bladder functional circuit is correlated with what the old Chinese called anxiety. And yesterday we talked a short time about it, that this anxiety is something which helps us to survive in normal cases. I had been in a seminar with a lady by Kübler-Ross. I think most of you have heard her name. You know the lady? Yes. And I met her 4 times last year, and I get friends with her. And she is a very fantastic woman to us. And she had found out that anxiety is not normal for men. There are only 2 forms of anxiety that have to be, and that are necessary for survival for men. That is anxiety if you have a noise on the backside. It's like a warning, like a signal. You have to look at what it is. And if you are on a ground which is very sharp, and you have to balance you
on a grade.
On a grade. If you're walking on a grade, it is normal that you have to control you and to check what it is, and therefore anxiety in such cases is normal for men. But all our other anxieties we have. And Elisabeth Kübler-Ross, she likes to ask each one of the group, what is your anxiety? And you can hear in such a group 40 different anxieties we have. Each one is another one. And she says that's not normal for men, and we have to overcome that in any way. And she taught us in her seminar over 1 week that one who is a therapist, if he had deep problems with his own anxiety, that will not be good for your patients. For in a way you will interfere with the anxiety.